Hi everyone, it's Rebecca here on Mindstone reporting you from my home base in Netanya, Israel. It is about almost 10 o'clock in the evening here, which I'm sure is close to about, I guess, 8 or rather 7, we're about 7 hours ahead of my hometown in Canada, in Toronto, Canada. For those of you who don't know, this is Rebecca reporting from Mindstone, which is my digital platform where I share my coping mechanisms and strategies for anxiety, depression, and bipolar disorder. Thanks for joining. In our last session, we talked about dialectical behavioral therapy. So just so you know, this is a popularized form of therapy for both anxiety, depression, bipolar disorder, suicidal individuals, as well as borderline personality disorder, which is the first disorder that it was used to therapy as a therapeutic method. I wanted to give you a little bit of a background of dialectical behavioral therapy. So I mentioned in my last session that it was done through a psychology professor and psychologist, Marsha Linehan. She herself was going through a lot of severe mental illnesses in her teenage years. And she wanted, one of the biggest reasons why dialectical behavioral therapy, or DBT, became so popular and effective was the fact that it actually married two very different models of therapy that were going on at the time, which was behaviorism and humanism. So behaviorism is when a therapist looks at a person's behavior and tries to modify that behavior and the thinking behind that behavior, and that's their primary focus. Issues with that came with the fact that a lot of the patients actually felt like their therapist was telling them that their symptoms were all their fault, and that it didn't have anything to do with their environmental factors or anything with regards to their relationships or anything going on in their life. Behaviorism is really primarily focused on that person's behavior and the importance of changing that behavior